But Dr. Mint, I remember him sitting next to me, and the most special thing he could have said was, "Give me a year of your life and I'll give you your life back." We were stationed in Germany for 5 years. Really excited we were coming back out Fort Carson. Came back for 3 weeks to California. Went to SeaWorld, went to Disneyland. I was exhausted. I was pregnant, obviously, but very exhausted. By the time we got to Carson, I could barely walk. I was just tired. And so they did a CBC, and the doctor, he came back in and he's frantically looking around my room. "Do you have any medical records? Did you bring anything with you? Do you have a history of low platelets?" Got the biopsy. I hear the nurse get a phone call in my room, and you could hear the doctor say, "Is her husband there?" And I knew. And they were telling me that I had AML, and that it was going to be hard. The hematologist came back to talk to me, and he said, "There's this hospital in Denver, and there's this doctor named Dr. Mint. He said if my family member was sick with cancer, I would send them to Dr. Mint." I said, "Send me up there." They transferred me in an ambulance. The nurse comes in and she says, "Honey, you can take off your mask. You don't need that in here." And I just started crying. I'm like, "But I have AML." And she said, "It's okay. We know what to do with you. We know how to take care of you." So pretty much there were 2 basic options: start chemo while I was pregnant, or wait till the baby was born. He said, "I'm confident as your doctor to keep an eye on your levels and know when I see the levels changing that it would be time to go in and take the baby out." He said, "But make that baby grow as many days as you can." He didn't feel any heavier than the blanket. It was so tiny. He was crying, and I said, "Shh, it's okay." And he stopped crying.
Kimberly has acute leukemia, and what we know about this disease is that it's a very difficult disease to treat, and our hope and expectation is to cure the disease with this transplant. Now, Kimberly's getting a special form of a transplant today. Kimberly is the first patient outside of Seattle and the first patient in Colorado to be able to participate in this novel trial that was developed with science at the Fred Hutchinson Cancer Center in Seattle, and involves using a new technique, a signaling pathway called the Notch signaling pathway, to tell stem cells to grow but to stay as stem cells. Kimberly has had high-intensity radiation and high-intensity chemotherapy over the course of the last week to prepare her for this transplant. So the infusion has begun, and it is as uneventful so far as we would expect it to be.
I'm a little jittery because I'm a little nervous.
Today we're 10 days out from Kim's transplant. Kim's transplant was the most intense transplant that there is in terms of the radiation and chemotherapy that we gave her. And though I wouldn't wish this on anyone, and Kim can probably tell you a little bit more about that, as these things go, I think things have gone incredibly well, and our expanded cord blood has done more than we had hoped. When we gave Kim her transplant, we had been able to increase 9 million cells to 2.7 billion cells, and our hope was that that would result in her white blood cell count recovering far more rapidly than it typically does for a patient undergoing this sort of transplant. And in fact, that's exactly what we've seen.
I'm grateful that I came to this hospital and met Dr. Gutman and Dr. Mint. I'm very grateful. The biggest thing that I would like to tell people is to, 1, get tested to be a bone marrow donor. It's really easy. The other thing that I would say to people is if you are having a baby, donate your cord blood. Obviously, it's going to save a life.